Another topic that we work on is to find solutions for non-healing wounds and life-threatening burns. As you know, we get wounded, we get burns, and in most cases, the body is capable of dealing with this injury and heal the burns, heal the wounds. However, this is not always the case, especially not in people that have other diseases and sicknesses, such as diabetes. Very specifically in diabetic patients, the ulceration, this means the formation of non-healing wounds, can be life-threatening, can cause significant morbidity that can eventually lead to the amputation of extremities if these wounds don't heal, to severe infections over time, and impair their quality of life. So for these cases, as well as for cases in which the body is burned to such an extent that there is no rescue by transplanting intact skin from other parts of the body, in these cases, tissue engineering can provide an adequate solution by engineering skin equivalents, artificial skins, that can then be placed onto the burns, onto the non-healing wounds, onto the diabetic ulcers. The basis for this is to generate a bioactive, a smart scaffold that in its mechanical properties, in its function, is similar to that of a skin. Obviously, it would be nice if one can produce an entire skin with all its cellular layers and then place such a skin onto a non-healing wound, an ulcer, etc. Such skins are available nowadays. However, they are extremely costly and they are limited in their availability. So you can treat a smaller non-healing ulcer, you can treat a smaller burn with such commercially available artificial skins. But you cannot do that with a person, as I encountered, for example, in some hospitals, a person that is burnt to 90 or 100% over the surface of his body, his or her body. So for that, we need off-the-shelf available skin equivalents, smart scaffolds that will accelerate, that will be available and accelerate the healing process, and in many cases facilitate a healing process which would not happen without it. Moreover, think about it, if you have a scaffold that can be quote unquote so smart that it can induce the regeneration of the healing process in a fashion which leaves a scarless, healed wound. For that, we have to understand the process of wound healing and translate this into a scaffold that then would be available off the shelf, have properties similar to that of normal skin, and be available on demand when a patient is brought into the hospital and needs immediate care. We are working on such materials, and specifically one of the more interesting materials that we have developed is a skin scaffold, a skin equivalent, that is based on green edible proteins. These are proteins that are derived from everyday food, such as soy, such as corn, such as wheat. We have learned how to use the protein extracts from these plants to weave scaffolds, to spin scaffolds. And these scaffolds are being tried out now in the lab and in animals as the first step towards clinical application.